My name is Aviva Mattingly, class of 2015, and I received the Preston Public Interest Grant in order to work with Soteni International in Kenya. I'm a neuroscience and French student at Bowdoin. I'm also a pre-med student, so I'm planning on going to medical school in the next couple of years. I think my separate opportunity absolutely made me a better and more well-rounded candidate for medical school, and is now making me more prepared to take advantage of the education I'll be getting in medical school. Because Soteni works to mitigate and prevent AIDS, I was not only working with individuals living with HIV and AIDS and the clinical officers, but I also understood the other factors that come into play besides just medical treatment. So one example was just how hard it can be to get drugs to the medical dispensary. I was told one night from my director that a $600 shipment of drugs was not going to be able to come from Nairobi to our rural village, and I had to somehow find it in close proximity. So the next morning at 8 o'clock, I got on a motorcycle. We finally got to the tarmac road, which was an hour away. We switched between two buses until we finally got to an urban-like area where there was a pharmacist. So we redid the entire budget. We found our new list of pharmaceuticals and then waited 3 hours for them to package it all. So when that was finally done, we got on our two buses, we switched to a motorcycle, and we finally made it home before the monsoon rains came from the afternoon. And so I just think that's a great example of showing how there's all these different factors in a new country that we don't even consider in the United States. And I understood how healthcare can interact with culture and also how it interacts with poverty, and how an individual's situation can really impact either how they view medical care and how they're able to obtain access. So I think going forward, whether I want to continue to practice in the United States or if I want to be a physician abroad, I'll be better suited to interact with my patients and understand where they're coming from.